Could taking a COVID-19 test when travelers arrive in Canada replace the need for a 14-day quarantine? The country's chief public health officer, Dr. Theresa Tam, says public health officials are looking into that possibility. It comes as Reuters is reporting that Air Canada is planning a voluntary COVID-19 test trial for passengers arriving at Pearson Airport in Toronto in an effort to help persuade the federal government to end strict quarantine rules. Here's what Dr. Tam said on the subject a bit earlier today.
We are, of course, very interested in the result, and it's in line with some of the kind of protocols I think should be looked at. And just to emphasize that a negative test in this study or this approach does not exclude you from quarantine, but they will find, I think, good. Some of the results will be of interest to everyone in terms of, what actually happens on arrival, the middle of that incubation period, and towards the end in terms of the testing performance and the detection rates, etc. So I think that we all look towards those kind of results with interest.
The government shut down entry to non-citizens all the way back in March, with some exceptions. Today, those restrictions were extended by another month until September 30th. And anyone entering Canada is still required to isolate for 14 days. For more on all of this, we've reached CBC medical contributor, Dr. Peter Lynn in Toronto. Hi, Dr. Lynn. Great pleasure to see you again.
Good to see you again.
We were just saying before in the commercial that it's a good thing probably coronavirus isn't on all the time, but that means we haven't seen you as frequently. So I'm glad to welcome you back. I want to get your take on these tests to start off with. First of all, how likely do you think something like that is? And especially how likely is it that those tests could substitute the need for a 14-day quarantine?
Yeah, there are other countries that are doing the same thing. They're saying do the test and then we could skip the 14-day quarantine. And that's a little bit sort of naive, because if I do the test, we know that the test is not perfect. So somewhere up to about 30% of the cases you'll miss. So that means we pick up about 70% of the cases. So therefore, we're going to miss 30% of them. And then once somebody has a negative test, the thought is, I'm good, I'm clear, so I can do whatever I want. What we still want them to do is we still want them to do their social distancing, their masks, their shields if they can't wear the mask, hand washing. All of that stuff still applies. It just means that they don't have to sit inside for 14 days. And so therefore there's that trade-off. And also the test takes about 24 hours, for example, for you to get the result. And so therefore during that first period, we have to keep you isolated. In some countries, you actually stay in the airport. In other countries, they ship you to a sort of like a hotel kind of situation until you get your test back. So therefore the logistics of that is difficult. However, there is a saliva test that we've talked about before where you can get the results perhaps in 4 or 5 hours. I know that there's a couple of Canadian companies working on even faster time turnaround. And so therefore it's easier to collect. You don't actually need a medical personnel to collect the sample and swabs. So that might be a doable thing in the airport situation. But the key thing to remember, that saliva test is only 90% as accurate as the swab test. So the swab isn't perfect. This one is now 90% of that. So therefore you're diminishing returns there. But definitely it's not a bad idea to do a test on people arriving and then telling them to follow the same rules that you and I have to follow. Okay. So in a strange way, they are better than us, right? Because we haven't had a test. They've had a test at least. And then we tell them to follow the same rules. And then it should be safe to allow them to move around in the community.
I have to ask you, do you foresee a time, I guess, prior to a vaccine where it's possible the 14-day quarantine could either be eliminated or just reduced?
Yes, and the reason is that 14-day may not be enough, because there's some data coming from South Korea where they followed 100 people that had no symptoms at all but had a positive test. And over a 3-week period, they still had no symptoms and they continue to produce virus. So even though that 14-day, we feel like it's protecting us, some of these people will never develop symptoms and then we'll let them go free, in which case they will again spread virus. So the best thing to do is basically tell them 6 feet apart, wear your mask, wear your shields if you don't like the mask, and wash your hands. And if they follow that, it doesn't matter really whether I test them or not, because they can't pass the virus to other people. So perhaps emphasizing that part of it is better than saying you've got a negative test and you're free to go and do whatever you want. It's probably better to emphasize you have to stop yourself from passing any viruses in case you're one of these asymptomatic virus factories. I'm now calling them virus factories, that they're producing these viruses. And you and I can't tell because they look perfectly fine. They're not coughing, they're not sneezing. And that's the group of people that will trigger that second wave, because you've seen that in countries they hit these almost zero numbers, right? 0 cases, like New Zealand, 0 cases, and all of a sudden you see it pop up. where's the virus coming from? Obviously, there's somebody that has the virus within their body that is not sick. And so they're the ones that can pass it to us, and they don't know that they have it. So let's just take those precautions for everybody and continue to use those precautions, even with people that look very healthy.
What's your read on the possibility of a second wave and kind of like what we should be watching for? I note today there was some analysis of Ontario, for example, where it's now 4 weeks into stage 3 and there's no massive surge in cases. So public health officials in this province were taking that obviously as a good sign. I know there have been pockets of places across the country where we have seen, larger increases than there were a month ago or even 2 months ago. But where do you sense we are on the curve? Like, are we headed towards a second wave? Should we be looking at that over the next few weeks? What do you think?
Yeah, so basically we're heading into the school. So therefore, that's going to be a collection of kids coming together. So that's the biggest mixture where we might have people that have no symptoms but carry the virus. So I think now we're understanding that in every single country, it's the same pattern. So there was the first wave, and then what happens is that the case numbers, everybody's very diligent, stays apart from everybody else and follows the rules. And then the case numbers goes very low. So we're in that very low period. And then all of them pop right back up. So France, Germany, Spain, UK, Australia, they've all popped back out. And that's because when the case numbers, you keep hearing, oh, it's very low, then we relax. So as soon as we relax, those asymptomatic virus factories, they're just producing virus. They're not getting sick. So they're around us. So as soon as I let down my guard, we get close, we have our masks off when we're eating lunch together, then I can pick up the virus. And then you'll see the case numbers fire up. And the reason why the second wave, every situation, like the Spanish flu and everything else, is larger is because you have more of these virus factories floating out there. So there's more people producing virus now than at the beginning of the pandemic. So therefore, when we let down our guard, there's more people out there to spread the virus very quickly. So that's why you see this rapid rise going upward, and the numbers that you'll hit is much higher. So that's why during this period when we're seeing low numbers, this is when we cannot say, oh, the virus is gone, so we're safe. The virus is still floating out there. We still have to do 6 feet apart, masks, shields, and wash your hands. If we keep doing that, we don't have to go through that second wave that everybody's predicting for the fall.
Do you think there is a way for Canada to avoid it? I mean, based on the numbers that you're looking at right now, and if you do see compliance with what you're talking about, is it possible for that to happen here?
Yes, it is possible to knock it down, because if you look at New Zealand, they had a couple of cases that was starting to spike up and they just locked right back down again. Now, do I think we have to shut down, all the stores and everything else? No, because I don't think we're getting it from the stores. We're getting it from parties that we're going around or people that look very healthy. So therefore, if we can keep doing the same things that we did at grocery stores during the worst lockdown, we were okay in the grocery store. There weren't huge outbreaks during the grocery store period when that was the only store that was open. So therefore, if we apply those same rules everywhere, we don't have to shut down the economy, but we can still keep each other safe. And I think that's the important thing. And as we're heading into the school, this is what we want to tell our kids as well, right? In other words, 6 feet apart, wear your mask. If you can't use the mask, then wear a face shield, because sucking in the virus becomes very hard if you have a face shield. Everybody always says that the face shield is leaky all over the place, right? But what it's doing is that for me to suck in the virus, the virus has to take a U-turn and then come up through my mouth. And that's very hard to do. That's why all of these things work. But just do not become complacent when you start seeing numbers around, let's say in Ontario, it's around 100 and it's bouncing up and around 100. There are many more people that are asymptomatic carrying the virus. They're saying about 45% of the people have no symptoms, but they still continue to produce the virus. And that's the big reservoir of virus that's sitting out there. Not to get you scared, all you have to do is very simple. 6 feet apart, mask, face shield, and wash your hands. So it's the same rules that we follow, even though we learn more and more about this virus. The way to protect ourselves is exactly identical during this whole period of time.
I've got less than a minute left, but a quick question that I know I keep getting from parents who are all, some kids are already back at school. Most kids are about to go back to school. It varies depending on where we live in the country, but especially for young kids, the mask question. I know for older kids, it's mostly mandatory, depending on where you live again. But for younger kids, how important is it for parents to try and get them as much as possible to wear that mask? Like, how much of a difference could it make in the classroom?
It's a huge difference. And the reason for it, we used to tell people it's to stop your child from infecting other people. And that's when people say, well, my child doesn't have an infection, so why are you torturing my kid with a mask? But in fact, what it does, it also stops your child from breathing in the virus. And the reason is that material slows down your sucking power. So you cannot suck as much. And so therefore, I have to physically be closer to the virus before I can breathe it in. And remember, the virus, it can't move, right? It has no wings or feet. So I have to actually suck it towards me. And so therefore, if you have mask material there, it will will slow that sucking down. And if you pick material that doesn't collapse, when you breathe and it sort of sticks to your face, that one makes you feel uncomfortable. So get material that's a little more rigid, that has the little pleats, and that way it won't be so uncomfortable for them. And for little children, if they really don't like the mask, then we just give them a face shield, because the face shield, again, it's very hard to suck the virus and make a U-turn underneath to get it into your body. And so therefore a face shield is much more comfortable for them, and they've got all funky characters on them, so they look kind of cool now, and so therefore the kids can wear them. So don't be afraid of using them. So face masks, if you can find a few of them, they are very comfortable if you can find the right ones, and then use a face shield if they can't use a mask.
All right, great advice. Thanks, Dr. Lin. Pleasure as always to have you with us.
Thanks,
Dr. Peter Lin
Thanks
joining us from Toronto. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.